Welcome to the Living Well Beyond Cancer Survivor series. Today's topic is, are you ready to gain strength after breast cancer? Thank you for joining us today. Cancer is a journey, and we recognize not everyone's path is the same. Everyone starts in a different place. Your age, your beliefs, your support system of family and friends, your general health or well-being, among other factors, contribute to where you are at the beginning. Also, your destination may be different. Where are you going? Is your destination finishing treatment and putting cancer behind you? Is it living with a chronic condition, managing the side effects to lead as normal and independent life as possible? Your destination is determined by the goals set by you and your medical team. Once diagnosed with cancer, your path may take you through different treatment choices. Surgery, chemotherapy, targeted therapy, radiation are all customized by your cancer care team to meet your needs and get you to your destination. With this specialized treatment, each person's side effects and intensity of side effects will vary as well. The tolerance to treatment will be impacted by your general well-being and where you started at diagnosis. Our team wants to help you keep your motor running smoothly through your experience and to your destination. I'm excited to introduce you to the Strength After Breast Cancer program, or the SABC program. Why was this specific program developed? Many patients affected by breast cancer may be fearful of developing lymphedema. Also, they may have been instructed not to lift over 5 to 10 pounds after surgery, or may be hesitant to start an exercise program because of the risk of developing lymphedema. With these concerns in mind, in 2009, Dr. Catherine Schmitz at the University of Pennsylvania conducted a research trial, the Physical Activity and Lymphedema Trial, or the PAL trial. The purpose of the PAL trial was to determine if progressive strength training is safe for breast cancer survivors with or at risk for lymphedema. The study showed slow progressive strength training is safe for breast cancer survivors who have or are at risk for lymphedema. The SABC program is based on this research study and includes the same exercises and exercise progression used in the study. This groundbreaking trial has helped hundreds of survivors regain their strength, endurance, quality of life, and reduce the risk of developing lymphedema. We will review the SABC program in detail, but first let's review lymphedema, its risk factors, and why exercise is important to your recovery. Before we get started, let me introduce myself. My name is Christy Thornton, and I am an occupational therapist and a ReVital Cancer Rehab certified educator. I am a certified lymphedema therapist through the Thornton School of Lymphedema and a certified hand therapist. I also hold a certification in manual occupational therapy through the North American Institute of Orthopedic Manual Therapy. I practice in the Dallas, Texas area, focusing on improving quality of life and functional outcomes of cancer survivors. The objectives for today's presentation are to answer the following questions. What are the risk factors for and signs and symptoms of lymphedema? Why is exercise important for lymphedema management? What are the components of the Strength After Breast Cancer program? Who can participate in the Strength After Breast Cancer program? And how can you become involved in the Strength After Breast Cancer program? So first, what is lymphedema? The lymphatic system is part of the immune system. Lymphatic fluid is always moving through the body to help the circulatory system balance fluid in the body, remove cellular debris and foreign material from the tissues in all parts of the body. Lymphatic fluid is comprised of water, proteins, bacteria, viruses, and triglycerides in the gut. The lymphatic system can be impacted by internal or external causes. Some of the most common causes are related to the treatment of cancer, including lymph node removal surgery, radiation, and other medical comorbidities that we will discuss later. Once the lymphatic system is impacted, it can cause impaired flow of lymphatic fluid throughout the system and abnormal accumulation of protein-rich fluid in the body part that's affected. For breast cancer-related lymphedema, the affected area includes the arm and chest wall, from the collarbone, sternum, and base of the ribs, around to the spine. This accumulation of fluid is not an increase in fluid, but a backup of the fluid due to the body's reduced ability to process fluid in the affected area. If the fluid is not able to be moved from the affected part of the body, changes in skin and tissue texture can occur over time. Lymphedema is a slowly progressing disease. However, it does not resolve on its own and should be addressed by a trained medical professional to prevent progression to more severe disease. Today, we're discussing breast cancer-related lymphedema. However, these risk factors can apply to other cancer types as well. For breast cancer-related lymphedema, there are 4 main risk factors. First, how many lymph nodes were removed from the axilla or armpit area? The more lymph nodes removed, the higher the risk level for developing lymphedema. Although having fewer lymph nodes removed lowers a patient's lymphedema risk, it does not guarantee that a patient will not develop lymphedema after surgery. Second, did the patient have radiation therapy? There are 2 types of radiation therapy, brachytherapy and external beam radiation. Brachytherapy radiation is very localized to the breast tissue where the tumor was removed and does not increase a person's risk for lymphedema. External beam radiation is administered to the chest wall and potentially the armpit area. This radiation causes damage to the lymphatic system, thereby decreasing the filtering function of the remaining lymph nodes and contributing to soft tissue constriction and fibrosis, or hardening of the tissues. The location of the radiation also impacts the risk level. Radiation to lymph nodes in the axilla increases the risk of developing lymphedema greater than radiation to the breast alone. Also, increased BMI, or body mass index, has been shown to increase a person's risk for lymphedema. Those with a BMI greater than 25, or those that lead a mostly sedentary lifestyle, are at greater risk for lymphedema. This is a modifiable risk factor that can be significantly affected by programs like the SABC program. Lastly, did the patient have an infection after surgery, or does the patient have a history of injury, trauma, or cellulitis infection in the affected arm? Because the lymphatic system is part of the immune system, these complications create greater stress on the lymphatic system, leading to potential overload and backup of lymphatic fluid in the affected area. Although previously mentioned risk factors are well researched and easily identified, there are other risk factors that can contribute to the breast cancer-related lymphedema risk. These factors are not as easy to quantify, but should be considered. Chemotherapy agents are systemic medications, meaning they affect the entire body system. These medications can tax the overall body system and increase the load on the lymphatic system, leading to lymphatic overload. This is most often seen with taxane-based chemotherapy. Even if fewer lymph nodes are removed, a person may be born with fewer lymph nodes in the axilla. In this situation, taking 1 or 2 nodes from the region is a larger percentage of functional loss and can lead to a systemic lymphatic overload. If a person was born with an underdeveloped lymphatic system, they would also be at greater risk for lymphedema. Patients with a predisposition to swelling through family history or chronic inflammation may also be more susceptible to swelling after cancer treatment. The heart, kidney, and liver all contribute to drainage and processing of lymphatic fluid in the body system. Dysfunction in these systems, as well as others, can stress the overall body system and place a patient at greater risk for swelling. The lymphatic system is interconnected to other body structures, including the muscles, joints, and skin, which assist the system to mobilize fluid effectively. If one of the listed systems is not functioning adequately, the movement of fluid can be impaired or slowed, leading to an overall backup of lymphatic fluid. This will be discussed in greater detail in a moment. As lymphedema therapists, we take all of these factors into consideration when assessing an individual's swelling. Some of the risk factors mentioned are modifiable and others are not. As a lymphedema therapist, my goal is to identify the factors that can be modified and assist patients to make changes to their health and lifestyle to best manage their lymphedema risk. What are the signs of lymphedema? In the early stage of lymphedema, the signs are not visible swelling, but sensations in the affected area. These symptoms would present on the affected side of the body and would cause a difference compared to the unaffected side of the body. These symptoms include heaviness, aching or discomfort, a feeling of fullness in the affected area, numbness, and pins and needles. It is important to note that lymphedema is not painful, but may be uncomfortable. If a person experiences pain, it is usually indicative of other conditions. In the later stages of lymphedema, a person would notice visible swelling beginning in the hand, wrist, or forearm that comes and goes. This swelling could onset after activity and resolve after rest or overnight. This symptom is the first outward sign of lymphatic overload and is an indication for assessment by a lymphedema specialist. The picture on this slide indicates the appearance of swelling in the left arm. This patient presents with a later stage of lymphedema that has progressed from the lower portion of the arm up to the shoulder. As the lymphedema progresses, the swelling in an extremity will onset in the wrist, hand, or forearm and will progress up to the shoulder, as shown in this picture. At this stage, the swelling will not go away on its own. And if left untreated for many months or years, the swelling continues to increase and the person might develop skin changes, including hardness of the tissue, texture, and color changes of the arms, and occasional wounds or infections. It is important to catch the signs and symptoms of lymphedema in the early stages when possible. The majority of breast cancer survivors have an onset of lymphedema in the first 3 years after surgery. Monitoring your own body for these signs and symptoms and reporting them to your medical team can prevent the swelling from progressing and becoming permanent or irreversible. The earlier we can catch signs of lymphedema, the easier management is. Now that we reviewed breast cancer-related lymphedema, let's focus on how exercise can help. In 2018, the National Comprehensive Cancer Network, the American Cancer Society, and the American College of Sports Medicine set up exercise guidelines for breast cancer survivors. The guidelines are the same as recommendations for the general population, although patients are encouraged to receive a lymphedema evaluation prior to beginning any exercise program. The recommendations underscore the importance of exercise for breast cancer survivors to address the many side effects of breast cancer treatment, including cancer-related fatigue, impairments in quality of life, and decreases in cardiorespiratory fitness, muscular strength, and physical functioning. The guidelines for exercise for breast cancer survivors include avoiding inactivity and deconditioning. Deconditioning can happen quickly, especially after cancer treatment. Avoiding inactivity can reduce the risk of deconditioning, increase weakness, and loss of overall function. Building up to 150 minutes per week of aerobic activity. This can be any type of aerobic activity and equates to 30 minutes of activity 5 times per week. Strength training is safe and should be performed 2 times per week. This frequency allows the muscles time to rest between exercise sessions. Start with a supervised program. This ensures the exercises are appropriate for you and performed with good form. Start low and progress slow. This helps to prevent injury, especially if a person is very deconditioned after cancer treatment. If you have any change in upper body symptoms that last a week or longer, get a therapist evaluation for swelling. Stretching exercises can be performed daily, and then take caution with overall arm work. Avoiding strenuous activities on the same day as strengthening exercises helps to prevent overuse. How does exercise benefit the lymphatic system? The effects of exercise on several body systems can impact the performance and overall function of the lymphatic system. In all body systems, much like in a muscle strain, systemic deconditioning can lead to an increased workload on the lymphatic system. The strain in this situation is increased swelling or other signs of lymphedema. Consistent exercise and overall system conditioning ensures that the lymphatic system is conditioned and able to tolerate workloads similar to pre-surgery levels. Unlike blood vessels, the lymphatic vessels don't have a heart to pump fluid. Lymphatic vessels rely on external force to move fluid. The external forces can come from several different systems, including the muscular system, skeletal system, and integumentary system, the skin. The muscular system, the lymphatic vessels follow the muscle structure in the extremities. Exercise improves the function of the lymphatic system in 2 ways, through increased muscle mass and increased muscle pumping. Exercise increases muscle mass, which provides increased muscle contraction and more pressure on the lymphatic vessels to move fluid out of a limb. This muscular pump is significantly increased with exercise and facilitates lymph fluid movement and promotes lymphatic drainage. In the skeletal system, joint movement applies tension to the lymphatic vessels and nodes, which improves lymphatic drainage and fluid movement through the overall body system. Joint movement also changes the muscle length tension and aids the muscular system in lymphatic pumping during movement. The integumentary system, the superficial lymphatic vessels attach to the basement layer of the skin. Skin stretch opens the lymphatic vessels to accept and move lymphatic fluid through the system. Cancer treatment can potentially affect the function of any of these systems, increasing the risk of lymphedema in an extremity. However, rehab and early exercise after cancer treatment can prevent some of the listed issues. Historically, there were safety concerns with exercise in women who have lymphedema or who are at risk for lymphedema. In the past, patients were instructed to lift no more than 5 to 10 pounds with the at-risk arm. Also, heavy resistance training, repetitive motion, and arm exercise was generally discouraged in women at risk for and with lymphedema. The PAL trial, which the SABC program is based on, was specifically designed to determine if this concern was valid and if this education was still appropriate for patients at risk for lymphedema. The results of the PAL trial showed that no connection between aerobic and strengthening exercise and an increased risk of developing or worsening lymphedema existed. Other studies showed exercise can reduce the risk of developing lymphedema with early post-op range of motion exercise, upper body resistance, and weight management. Exercise may also reduce the severity of lymphedema and reduce the frequency of lymphedema flare-ups. This effect is due to conditioning of the lymphatic system as previously discussed. Let's dive deeper into the details of the SABC program. Potential participants are evaluated by a therapist to determine if they currently have lymphedema and if they need additional treatment for lymphedema management prior to starting the exercise program. Additionally, they are educated in the connection between lymphedema and exercise prior to enrollment in the program. The program includes 4 to 6 sessions of supervised exercise over a 6 to 12-week time frame, depending on each individual's needs. Each session is designed to build an exercise program that includes stretching, strengthening, and aerobic conditioning, consistent with the American College of Sports Medicine guidelines mentioned earlier. The sessions follow a specific progression to ensure that patients are tolerating the exercises without signs of lymphedema. The amount of weight used for the resistive exercises is different for each person and is determined by the therapist. To begin, the exercise program is supervised to ensure safety and correct form when performing the exercises. The program is progressed slow and steady, and the therapist monitors the participants closely at each session, provides education on self-monitoring of symptoms, and building confidence to continue exercise lifelong. Engaging in regular exercise helps to maintain a healthy weight, decrease fatigue, improve sleep, and reduce anxiety and depression. The specific benefits of the SABC program are well documented in articles appearing in the Journal of the American Medical Association and the New England Journal of Medicine. The PAL trial participants showed a 50% reduced likelihood of lymphedema exacerbation with the exercises if they already had lymphedema. Also, a subset group that had 5 or more lymph nodes removed, a higher risk group, showed a 70% decrease risk of developing arm swelling with participation in the SABC program. Study participants also noted improved strength and energy, improved body image, reduced body fat, decreased functional decline, and improvement in bone mineral density. The SABC program has been shown as a gradual and safe way to load the lymphatic system to overcome deconditioning. These results provide hope and empowerment to patients looking to reduce their risk level and regain full function following cancer treatment. So let's get into how the program is outlined. The Strength After Breast Cancer program has 5 core components. An aerobic warm-up is performed for at least 10 minutes at the start of the exercises. The type of aerobic exercise can be chosen by the participant based on their interests. Examples include walking, biking, or swimming. Next, there are 8 stretching exercises, 3 for the upper body and 5 for the lower body. These are performed in a specific order for a specified time. Third are core strengthening exercises. These 3 exercises focus on building a strong center or core to support strengthening of your upper and lower body. This is a foundation to any good strengthening program. The next step is when we pick up those weights. There are 9 resistive exercises. They alternate between upper and lower body to load your lymphatic system, but not overstress it. The program finishes with cool down stretches. These are the same movements used during step 2. Your therapist will instruct you in the program components over the 4 to 6 sessions and provide cues to maintain proper form with the exercises. You'll be given a booklet, including an exercise tracker, to build your confidence and independence with the program. Monitoring of any arm symptoms will also be performed at every session before the exercises are progressed. You may wonder, when can I participate and gain these benefits too? The Strength After Breast Cancer program was designed for and researched with breast cancer survivors. It can be performed at any stage of the cancer journey, from the time of diagnosis, including before surgery or other treatments, during cancer treatment, or after completion of cancer treatment throughout survivorship. The patient's therapist will confirm that they are cleared for exercise after surgery and don't have other limitations for weight training or exercise participation. There is no requirement for previous exercise experience to participate in the program. Participants will be progressed through the program at a pace that fits their ability and needs. Participants may be seen in a group setting or individually. And this program is covered by commercial insurance and Medicare with a trained physical or occupational therapist. If you or your family member didn't have breast cancer, the principles and benefits of exercise can be applied to other cancer survivors. It is important to consult with your therapist to develop a program that is right for you. I wanted to leave you with this quote from Melanie Young, a breast cancer survivor and host of the podcast Fearless, Fabulous You. You may not have chosen to have breast cancer, but you can choose how you will face it and how you will use this experience to make sure you stay in good health from this point forward. Although a diagnosis of breast cancer is never welcome, our mission is to make cancer rehabilitation the standard of care for anyone affected by cancer to allow you to live your best life. You can learn more about ReVital Cancer Rehab on our website, revitalcancerrehab.com. There are ReVital Cancer Rehabilitation programs across the country composed of licensed physical therapists, occupational therapists, and speech-language pathologists who are also certified cancer rehab specialists. Each is able to take a detailed history and accurately evaluate your individualized cancer rehabilitation needs before, during, and after your cancer treatment. On this site, you can connect with our ReVital Cancer Rehab team to find a Strength After Breast Cancer program near you as well. We hope you enjoyed this presentation of Living Well Beyond Cancer, How to Gain Strength After Breast Cancer. I thank you so very much for your time today. It is such a gift we give to one another, and I'm grateful you shared some of your time with me. And I could not have completed this presentation without the help of amazing researchers and clinicians throughout the country. Here are the references for this presentation. Thank you so much.